Hello, sir.
Hi, how are you?
I'm good, sir. Am I audible?
Yeah, very much. Yeah,
Sir,
yeah.
let's wait for a few minutes so that everybody can join. Good
Sure,
evening.
sure. Yeah.
So, this is also your first time coming live, right?
Yeah, I've done a short, pep talk, but
Okay.
not a programmed one, like where we have announced and done that.
Okay.
Good. Yeah,
I think people are joining.
sure. We'll wait for a
Yeah.
few minutes. Yeah. Okay, good.
Today also you had that course.
Yeah, we had our second day of the COMT, so the
Oh,
new batch has started,
okay.
and yeah, Yankee has joined.
Yeah, she told me yesterday. How many students are there this
Oh,
time?
closer to 30 plus.
Oh my God,
Yeah,
that's great.
yeah.
Okay.
And still, we had many more people. We stopped because of a lot of demand to know about manual therapy and the COMT. Yeah, quite a lot of people. Yeah.
So, plan one of your courses in Jaipur.
Sure, sure. We will do that.
Yes.
We will do soon. So, you have a regular talks for your patients, or generally, how do you?
No, sir, this is also my first time coming live with you
Oh, very good.
on Instagram. Yes, sir. Let me know, sir, when can we start?
Yeah, yeah. When you're ready, we can start. I'm
Okay.
okay with it.
All right, sir. So, good evening, everyone. Welcome to tonight's exclusive Instagram Live. And I'm your host, Dr. Nidhi Negi. And tonight we have a truly monumental session ahead of us. We're in conversation with a visionary who has shaped the landscape of physiotherapy, a pioneer with over 30 years of clinical excellence, who has helped over more than 3 lakh patients and mentored more than 20,000 physiotherapists. He is the founder and president of Federation of Indian Manual Therapists, that is FIMT. He's Australian trained and emeritus professor Dr. K. Paulson. So thank you so much for joining us tonight.
Thank you, Nidhi, for making this evening memorable for me also, and
Hmm.
as well as for all the people. Yeah. So the journey of Federation of Indian Manual Therapy is when I started after doing my post graduation way back in 2000 in Australia. So where we had a post graduation for musculoskeletal or manual therapy. So my intention was not to do any courses like this, but when we came back over here and we found the system. So let us think that, okay, let us spread the knowledge of manual therapy as far as we can. So we were four of us wanted to start this federation, and all the three left within 2 3 minutes through 2 3 months to abroad. So so I have to take it forward over this. So our main aim was to consider manual therapy as one of the treatment for all the musculoskeletal and sports injuries. So I happen to go regularly to the Sports Authority of India, Bangalore Center, very often, like weekly twice, and I used to meet the scientists over there. So over there, they talk about the importance of manual therapy, which is happening all over the world, and as well as how exercise therapy is more important for the athlete. So one of the main purpose of manual therapy is to have a first contact practice. So we are very happy now. Indian government have recognized physiotherapy as a first contact practitioner, and they have approved it where we can put a doctor with a post-fix PT. So that
Yes.
means, so if you want to do a first contact practitioner, we need to have a good manual therapy assessment skills.
Yes.
So what we had in the Australia, which made us to think is, okay, the assessment part is the biggest thing. So if you take a 45 minutes of treatment for a patient on your day one, so 30 minutes goes to the assessment and 15 or 10 minutes is the treatment. So it's a more of, skillful assessment which we want to do. And as a FIMT, when I started way back, very concretely on the year 2002, we had very few people supporting manual therapy as a skillful program because everyone was behind the other forms of physiotherapy. So we wanted to bring this manual therapy as a education, as a training, a program for most of the people. So when we look back in India, there are very less people who are teaching, even at the university level. So I want to quote you one thing, like, way back when I started the website and put it over manual therapy. So I had a patient who came all the way from Manipur to Bangalore to get treated because there were less people in between. You know that, like, it was more than 2,000, 3,000 kilometers far away. Still, the people were looking for that skill. So that is the reason which made us to think about start a program, and at the same time, at the cost of, our Indian population. So the treatment and as well as the skill education came into a package like in such a way that our Indian physios should get better. And because of that education, there are a lot of people who went back to the same university where I studied. Not only that, many other places to get more skilled, programs. So it was a lot of hurdles because there are a lot of people who said to me, who will join this manual therapy program initially? Who will learn this at very, I'm talking about something on 2001 and 2. So it was a challenging task for us to start with that. But at the same time, when we persisted, like, we had around 4 to 5 programs in a year with the 20 people, 18 people, 15 people. And when it reached all over the other parts, and there were other few people who also started doing this, which helped us to reach to the corners of India and to make people to think that, okay, there is a manual therapy technique or a manual therapy skill which has to be used as a part of physiotherapy rather than a adjunct therapy. That's what the journey and the hurdles what we had. Yeah.
So it's
Good.
an absolute honor to have you here, sir. Let's dive right in. So, with over 30 years in clinical excellence, you've truly shaped the landscape of physiotherapy in India. So, looking back to when you founded FIMT, what was like the biggest skepticism or the hurdle you faced regarding manual therapy, and how does it feel seeing it becoming a mainstream pillar of treatment today?
So when we say, like, when I started manual therapy, like, most of the people, like, most of us, including me after my undergraduation, and when I had an opportunity as a short stint to work over in abroad. So we had a lot of, electrotherapy. So yeah, it was a electrotherapy driven program. So even when we had our clinical program as a part of internship or as a school at the undergraduate level, we were driven postings through electrotherapy driven. Like, for example, you are posted for a short wave, you are posted for a ultrasound, you are posted for other missionaries, and we have an exercise. And there is no manual therapy driven programs, even though we had our basic books which talks about it. So when I told my friend that, okay, I'm going to start this program, and everybody said, okay, what is it exactly? So I said, like, something like a glide or something like a movement. So we are trying to use the normal biomechanics to help the exercise to happen the same way the manual therapy glides also will come. And they said, oh, is that going to help us? So I said, the whole world in Australia before 1985, they were like electrotherapy driven,
Yeah.
but it is not helping them to get the insurance. It is not helping them to get more approval on the terms of economical. So they have changed, they have modulated, they made a lot of researches in manual therapy and exercise and everything to put manual therapy on the top as they required, because they want to push something which can be done identity by me. So the hand is the whole and soul of the patient and the therapist, where we drive through the movement. So when, as a therapist, like for example, if someone has been treated by you in Jaipur, will always follow you because of your skill rather than going to someone in between. So even though you live far. So that was a skill, it's like, it's a kind of art which can be learned only through your proper education and as well as by you. And when we try to put it into people, there are some few seniors and juniors who joined with me who want to encourage this program. So when we did that, they said, "Oh, it's all about the hand. So what will happen? Should I give electrotherapy after and before?" That was the first question. If not, if the patient asks the electrotherapy, what I will do? So will it help me? But the system has helped because a lot of researchers have been proved by the time. So I would say, like, in the early 90s, that's where the core muscle strengthening, where transverse abdominal strengthening using the biofeedback method was very much used in the Western country as a research. So most of the physios who are doing the post-graduation program have following that. So they found that it is very effective as the exercise. So then they started following all the rhythm of the manual therapy, which has been exposed in the literature. Because, reaching out to abroad is a big stake, and as well as reaching to programs when a foreigner comes in, that is also very difficult. So we have to make sure that the education process goes according to the need of the Indian population. So we kept the price in a such a way that so it should not have a difficult, because over the time, when I say 2001, 2 and all, the basic salary was closer to, for a young physio, maybe a 10,000 or 12,000 or not more than that. I'm saying, it ranges. So we kept the program in a such a way that so they should be able to pay according to their monthly salary, and they were given a lot of support in backup in treating the patient with a lot of input through the every week program. So which gave us to break through that. So once the first program went on, so all the people were interested as every time. So I still remember when I gave certificate for the first program, which was 8 people, and the within a 2 3 days, I got 20 people for the next program, which I have planned a month ago. So, but it is reaching out to the people. So when you want to reach to the people, when you want to reach to the public, and when you want to put a technique into that, so we need to shell out a lot. So we really had a lot of hurdles to pass through that, because people say that, oh, the massage was good. They don't say manual therapy.
Right.
And, yeah, we need to explain to them what we are doing and how we are getting it, in hand in hand. So right now we are very happy and proud that we are able to sustain all these years through our program to get better. And we are able to reach to the nook and corner of India and as well as other places to reach the word of manual therapy, where it becomes a important skill in the assessment and treatment of all the physiotherapists today. Yeah, thank you.
So that is incredibly profound. Hearing about the early hurdles really put us into perspective of like how our field has evolved. That's because of your foundation. And so, okay. So my next question to you is, sir, how has the mindset of both patients and general practitioners changed regarding the efficacy of manual therapy over the last few decades?
So, like, for example, like, if you take the Western and the Indian bridging, if you look at, so
Yeah.
in the Western countries, like, they had a different concepts. So they have put on together with piling up, like having a clinical discussion, which we never had in the early 2000, where we don't have a clinical discussion. So maybe we would have had it in the hospital side or in the institutional side, or not as a professionals getting together. So we had very difficult to communicate to patient and as well as the fellow therapist. Okay, this technique is going to help you. So one of the catchy things I would say, like, we have to tell the people, so these are the techniques followed in other Western countries where we are trying to follow. So there was a kind of attraction for the professionals. Oh, we are trying to follow that. And they also try to, reach to their friends over in the Western country to know that, oh, how they get. And when we get patients who come from abroad, people are very familiar with osteopath or chiropractor over that time also. I'm saying 2000 and early. So people are very happy to know that, oh, you are trying to give. So I had one patient who has come to yoga to Mysore for for a three month stint. So she was looking for a manual therapy, and she needed 1 second fixation. So, like, she need a second sound, the manipulation. So she went over there and she was looking for someone in Bangalore they back in 2003. So someone has directed to me and she came. So once she came, so she just said me one thing: can you fix my dysfunction with 1 second movement? So when I did that, and she knows what to do as an exercise, and being a yoga therapist, yoga person, she knows the background of what to help. So there were learned people who helped the manual therapy to open up to the public, and we have literally put a lot of news inductions to the public, like to the reaching to the local areas where we talk about what is manual therapy, what we really do, and how we get into the position of treating each and every treatment by the help of the skills. And as we scale up today, we have a lot of programs happening in India. We have a lot of mentors which they are trying to project manual therapy skills, and the mindset has changed people from the electrotherapy to manual therapy, and from manual therapy to active exercise. That's what I believe. Like, the Pilates and yoga and other things are uh, uh, bringing up a lot of addition to the physiotherapist. So I
Exactly.
hope our
Going to
people
the
have,
gym is always helpful. Sorry
yeah,
to interrupt.
yeah. So I feel always the physiotherapists have learned according to the need of the market, what they want, and as well as they also get trained. I hope we have around closer to 1.5 lakh physios in India, and at least 10 to 20% of people are better skilled in manual therapy skills. So which helps us to compete with any Western treatment. And if I go to any other country, I will be able to talk to their level, or I'll be able to talk better, because we have more of a lot of patients compared to the Western country. So always our medical system is much better rather than what you have in other areas. So we had a lot of hurdles, as you said, but we have to educate. Like, I need to spend at least 10 minutes to talk to the patient about manual therapy and its effectiveness in the earlier stage. And now it has reduced and we are able to manage without that. So that was the hurdle, like the time taken and the effort put on by us earlier to educate the patient, and education to the physiotherapists were a lot. So earlier, like in our education system also, when we want to do a program, next program, we call up a tea party, like during the certificate presentation. So there were like 30, 40 physios will come. We teach a technique. Let us say I teach a technique for cervicogenic headache at free of cost to all the people. And out of that 40 people, on 10% or 20% will be really interested. That is how we reach to the people in the early stages. Yeah.
Thank you so
Good.
much, sir. It was
Yeah.
really insightful. Now let's dive into the technicalities. Like in our ortho musculoskeletal practice, we often talk about evidence-based clinical reasoning. However, every patient on the clinic table is unique. So, how do you teach young therapists to seamlessly merge strict scientific literature with hands-on intuitive clinical reasoning during a complex assessment?
Yeah. So,
Like it's
well,
very difficult.
yeah, I know that. Like, see, as a beginner, I'm just thinking about how I was when I finished my undergraduate way back in 97, or how I was when I finished my, post graduation program in 2000. It was very hard for us to understand that, okay, we are not able to identify uh, as yet, you know, any skill. So today, like I learned something. So today I was teaching elbow and wrist to the physios who came to me. So what will happen? I have taught them some skills and some technique. So I would have said them, okay, you do this technique for this patient, right? So if I try to look that as a skill alone, we get failed.
Yeah.
So we need to look as a patient driven. So like, it should be, the patient should be able to put across their issues, their disorders, and we have to treat as a whole rather than testing my skill or trying to test some technique on the people. So we, as a therapist, if I want to get better as a whole science, as a whole human, like for example, if I learned, okay, I want to give a PA glide to the shoulder, which will increases the flexion or which increases the movement. But if I understand that, so as a human, so what are the other issues a patient will undergo? So what is the neuroendocrine system? What is the neuroimmune system? So what is happening to the lumbar region? What is happening to the lower limb muscles? Or what is happening to their, the positions? The why the postural stress is there on one side. So as a whole, when we try to look in, we will be able to break down. That's what we always, as a therapist, I hope all the therapists make a working hypothesis. So
Yeah.
as soon as the patient come in, they say that, oh, this is a back pain. But back pain could be because of something else. So we need to make a lot of working hypothesis till we conclude that, oh, this is the problem happening to the patient. So we have to understand that complex. So I tell the people, you always treat as a whole. Whether the patient comes with a toe pain or a head pain, make them to do a gait observation, make them to do a movement, make them to do the movement which causes the pain, make them to do some kind of activity which increases or reduces the pain. So rather than I know that okay, tennis elbow, I can do this movement which will fix the pain. But at the same time, the tennis elbow could be various factors. That
Right.
could be a lower limb. So that complex thing, people has to understand that. So that's what I